You referenced my conversation with someone from one of the trade unions, Unison. There are, I understand, 93,000 vacancies currently within the NHS. Why is the figure so high? Why are people not attracted to this profession?
Well, there are a whole range of factors, and it shows not only do I read my newspapers before coming on your show, I listen to your show before I come on it.
Good to hear.
As well.
Thank you.
We've taken steps. You're absolutely right to highlight that historic level of vacancies. We have seen since 2010 a very significant increase in healthcare professionals in the NHS, 30,000 or so more doctors, 38,000 more nurses. Just last year, 2020 to 2021, we saw nurses go up by 11,000, doctors by 5,000. What we need to do, though, is not just recruit, which we're doing, and we're growing that workforce, but as your previous caller, your previous guest said, we've got to look to retention as well. Now, that's partly about pay and conditions. It's partly about getting those extra staff in to share the workload around more. It's also about more flexibility. So in looking at retention, we're looking at how we can be more flexible in how nursing staff and other clinical staff work to better fit their lifestyles and their work-life balance as well. So it's about choice for them as well.
Isn't this shortage of staff just another casualty of Brexit? You're aware of how many people left, how many Europeans left the National Health Service, are you, between 2016 and 2019?
Well, what I've seen, Nick, is that the reduction, you're right to say, it was mainly in nursing, if I recall.
22,600 European nationals left the National Health Service post-Brexit, 2016 to 2019, 8,800 of whom were nurses. So that's one of the impacts of Brexit, isn't it? It denuded the National Health Service. Well, actually,
the important point here, Nick, is if you look at the NHS recruitment in the round, you're right to highlight that in some areas we've seen some leaving. We've also seen an increase in recruitment and people joining the NHS from other countries outside of the EU. And I'm doing this from memory. I think it's a net positive overall in terms of people coming in compared to people leaving the NHS. So I think we've got to be a little bit careful about looking at it.
But we could do with those 22,600 staff now, couldn't we? EU nationals who decided this is another result of Brexit, is it not?
No, I don't think it is, Nick. I have to say, and I don't often disagree with you, but on this I do. I think a factor of this, and you're looking at some of these figures, a significant chunk of those people also was over the past couple of years. There were a large number of people who will have gone home during the pandemic, either to support the healthcare system in their own country, or because they wanted to go home and see their families. But we have seen changes in the past few years as well, and that's a factor. And we've also seen EU citizens continuing to want to work in this country, coupled with the additional workforce we're seeing coming in from other non-EU countries. So it's a more complex picture, I think, than simply that, Nick.